Your health totally matters, and that's why we have Chris Moore here with us from Nordic Laboratories. You are from the UK?
I am from the UK originally, but I moved to Denmark 28 years ago.
Okay.
So I've lived there ever since.
Tell us, what are you doing with Nordic Laboratories?
Well, I think a little bit broader than that. If we talk about Nordic Group, it's a company that started in 1997 with the idea of wanting to change healthcare. It's a pretty big ask, and we're still struggling in some ways to work out that route. Where are we going with healthcare? What is the dimensions of it, and how do we achieve it in a way that benefits society? So one of the first things that concerns me most of all about the world of healthcare is ownership. Who owns your health? Well, actually only one person, and it's you. And you can't hide from that, and you can't run from it, and your doctor's not going to be the person that saves you. So you've got to take responsibility. On the flip side of that, you've got big industry claiming they own health. So drug manufacturers, or hospital settings, or the so-called doctor in the white coat, they all say, we own health. So we have a philosophical challenge around this. And first of all, I don't think anybody owns health from a perspective of corporate. We are custodians. We're here to shuffle in the next generation of knowledge. It's ongoing, it's continual, and you have multiple different areas that we have to consider. So that's in a way what we want to do. We want to say, okay, how do we address well-being, number one? First of all, although people talk about prevention, or they talk about optimization, or they go, okay, how do I perform better? The majority of people that pursue a personalized health are really people that have some sort of clinical condition. They might have chronic fatigue, or they might have stress, or they might have food allergies, or they might have migraines, or what have you. So they've all got something clinical, and they're trying to find a way to solve that problem. But what we want to pursue in this industry, is no clinical condition and optimization of all function. So in a way, that's what we do at Nordic. We're looking at laboratory testing from the Nordic Laboratories. We look at the right food, the right supplements. We're looking at the right exercise. We're looking at the right mindfulness in different aspects. And what we've done here at this event, and what we're promoting, is what we've termed ourselves the Nordic Biohacker Experiment, which sounds a little bit grandiose, but in reality what we're trying to do is engage with a group of people that want to find out more from how their bodies work, and then in a group setting, over a course of a year, we want to help guide them in a way that their health evolves, rather than a snap thing, oh, I'm ill, save me. No, I'm well, and make me stronger and better.
Optimize the health. So more about health rather than sickness.
Yeah, ultimately.
Which is our natural state,
absolutely,
anyways, to be healthy.
And yeah, go ahead.
What's this that you have here?
This is part of the package that we're doing. We have, put that for the camera so you can see it. This is one of our offerings. We have 120 different lab tests from Nordic Laboratories, but one of our divisions is genetics, and DNA Life has now been around for nearly 15 years in one form or the other. And our mission with genetics is to help people understand really how they're constructed. And this is this myth. Genetics themselves are not your determinant of health, but they are the interactor of health. And if you don't get to grips with how your genes work and how they interact with the environment, then you're doing yourself a disfavor. Ultimately, the more you know about your structure, the easier it is to work out the weak areas of your body. So, for example, you might have challenges with methylation genes. There's a lot of talk about it. Some experts have focused exclusively on this area. I don't think that's right, but it's still interesting. So if you have a sluggish genetic methylation gene.
And could you just tell, because some people watching this around the world, they maybe don't know anything about that.
Methylation.
What does it do?
Well, methylation essentially is perhaps the most important biochemical function in your body. It's what gets rid of all the rubbish, effectively, and moves it out of the body. And you need certain functions to do that. And at a very basic level, you have a measurement for something called homocysteine. Homocysteine should be at a reduced level because it's turned over. But if there's blocks in either genetic construction or in the functional status, then that homocysteine gets elevated. And in very simplistic terms, we need to keep it down.
Okay.
What are the mechanisms? Effectively, there are 3 B vitamins, B6, B12, and folate. They are the interactors. If you have impaired methylation, often it's because of one of those, or the cofactors of these B vitamins will enable that homocysteine pathway to move homocysteine out of the body, or the methylation pathway. And it's it's one small aspect, but a very, very important aspect. And many, many, many clinical conditions are associated with elevated homocysteine, and homocysteine can be dealt with relatively easily.
And some people are born with a gene that
Correct.
tips the scale a bit against them. In that.
What it does is that it means that the body's having to find a different way to methylate.
Okay.
And if you know that, you go, let's keep an eye out. Maybe there's something we can do later on that will make sure I never get in a position of having elevated homocysteine. That's the promise of genetics, that we learn about our in constructed weaknesses, but mitigate because we understand where it plays out in the function. And if you maintain that, then you won't have that problem.
And we've seen so many cases of that here. For example, Teemu had the gene for Alzheimer's, and then just through some lifestyle dietary changes was able to bring it down 70%, which is out of the wrist zone. It's massive.
Well, and that's, I'm assuming you had ApoE4, and ApoE4 is associated with a very significant increase in Alzheimer's risk. But why would you wait till you got Alzheimer's to do something
when
about
you could
it?
easily, yeah.
That's the real promise. So personalization of healthcare is essential. There is no point being in a cohort where everybody, where let's just say you were in a study that 90% of people did better, or even 99% did better, but you're the 1% that didn't. Why would you want to do that intervention?
Yeah, I keep hearing that here, that in this time in history, there's literally no reason to be sick anymore.
No, I think
we
that's
have the science and technology to be in perfect health.
I think that's right. But so part of the story, I did a talk yesterday, and what I was trying to elicit in that talk was that healthcare isn't a 9-day wonder, and it isn't something that happens overnight. It is in fact something that you do over your lifetime. And in fact, what we now understand, and we're doing a study through our colleagues in America, we're doing a study at the University of Las Vegas for what's termed, our concept is called Grow Baby. And we can tell from the genes of the mother her likelihood of being able to carry her unborn child to the full term and born at normal weight. 2 major mitigators of all diseases. So if you can have a child born at 9 months at a normal weight, you're going to help them immensely. And we have that technology and know-how. So we think that wellness or health or well-being or optimization is actually preconception.
Okay.
So we've got to ask a parent some questions. That's one thing. Then it's pregnancy and fetus growth. And then obviously when we're born, what do we do to not put ourselves in a position of inflammation, of stress, of food allergies, of whatever, which are pretty simple for a little kid to deal with. But if you don't do something, it carries on and carries on and carries on. So that when you're an adult, it becomes a major problem and becomes probably a chronic condition. So you're right, absolutely. We have in our hands tools that will be able to but I believe today, at least a newborn has the potential to live to 120 without disease and probably without aging very much. And that's what the promise of longevity is delivering. Longevity is not about extending a life through medication. It is about cellular performance, meaning that you age slower and that all your faculties remain and that you're able to perform at 100 the same way as you performed at maybe 40.
And we have more things on this planet than we've ever had to enjoy life. So why wouldn't you want to enjoy it to the best? And that's also why it's called healthcare and not like sick care, because it should be about health.
Yeah, and I think we have to, in society, also take a responsibility.
Absolutely.
We have a healthcare system as and we would call it a sick care system, but let's not be too facetious around it. We'll call it the healthcare system that is there to provide a support in the need of a crisis. The challenge, though, is that most of us don't take responsibility to avoid the crisis. So we just carry on. We carry on with the lifestyle that we've had. Oh, it doesn't matter. I'll be fine. I'll be fine. And if I'm not, I'll go to my doctor and he'll save me. Well, that isn't morally right. And it's certainly not socially right. Because we have a social obligation to each other to keep well. It is not okay to have type 2 diabetes when it's immensely possible to avoid it. And I think that's our responsibility in the 2020s, is to start putting your hand up and saying, I can do better, I can eat organic food, I can eat less, I can do more exercise, I can look at my biochemistry, which is what we're promoting and trying to elicit, and saying, okay, I'm going to take my body and I'm going to maximize it, not just for myself. So a lot of, this is perhaps a little bit political, but a lot of biohackers are here for themselves. I want to do better. I want to be more powerful. I want to run fast. Great, wonderful. But actually, we should be doing it for society.
Absolutely.
Because if we do it, and we do it well, then all the pressures on the healthcare system that we hear about every day in the newspapers, that they're running out of doctors, they're running out of money, they've got too many patients, a patient waiting list, that all will fall away. And I think we as a society have to start stepping up and take that responsibility.
It's really interesting you talk about our collective responsibility for health, because I actually heard some data, and I don't remember the exact numbers off the top of my head, but it was like the NHS in the UK, if the budget would be like 100 billion for health, out of that 80 billion was on 3 diseases and things related to them, one of them diabetes, which you mentioned as well, and all 3 of those are completely like recognizable with testing such as this and easily avoidable.
Yeah, really. And I'm not even sure why we're in this state, because it's not something that's come out of the blue, this knowledge. We started Nordic Laboratories in 1997. I was told by a practitioner in 1994 that healthcare was changing, that it was all going to become personalized, that we were going to be measuring these analytes. And yet, 25 years later, the mainstream so-called health industry still doesn't adopt it. With that said, and with the deepest respect, if you go to the NHS's website, you will find a fantastic statement alluding to where they think healthcare is going for the 2030s. And it is, when you read it, there's not one of us in the biohacking world or the functional medicine world that doesn't go, oh, that's what we think. So we shouldn't be naive around this and think that we're alone and we're the only flag bearers.
No, for sure not. No.
But the industry has a difficulty in knowing how to take from a strategic management system where you're looking at protocols for a disease to going to a system of individuality that the doctor has to think differently, really very differently. They have to approach their patients saying, okay, we're going to look at the underlying biochemistry, we're going to look at your genetics, we're then going to find a pathway to that intervention. We now have 8 Nordic clinics around Europe, all based around that function of saying, okay, how can we make you understand more about the way your body works? So we're in the private sector, but the public sector will also come this way in time, we as a company this year have adopted and started promoting a fantastic, really a fantastic test measuring 70 solid tumors, not to identify everyone with cancer, but in fact to measure people, to have a status, to say you don't have cancer. So I'm 51. I did my test last year. I have no cancer activity in those 70 solid tumors from a single blood test. It costs €1,000 or whatever. And I have that knowledge. Now, I could say, "Way, I'm awesome." Or I could say, okay, that's my baseline, and next year I need to do the test again to ensure that I still don't have cancer. But if I did, I would know that it's in its early stages.
It's great you mentioned cancer, because then we say, oh, that's so expensive, but the money people spend to get better from something like cancer is ridiculously expensive. In closing, can you tell our audience where could they find more about the work you do in order to own their health, like you said, and take back their power?
For what we're doing at this conference is as I said before, I put this up here, maybe we can zoom in a little bit. Where is it? There. Is the Nordic Biohacker Experiment. And although it's not an experiment in terms of a clinical evaluation, what it is to say, can we take a cohort of people interested in their health, help them understand their biochemistry through genetics to start with, and then through a 12-month program, learn about how they could do other things, other tests, other supplements, other training things that will impact the way their body works. And then through the year, we'll do reports so that we as a community come back and say, wow, biohacking does work, our performance does increase, we have less stress, or we have less pain, or we have greater neurological function, and then we'll report it back here next year and say, this is what happens when you do a concerted effort over time. So that you can learn more about that, and we have some special offers, but you can go to the NordicBiohacker.com website, or you can find out more about the Nordic Clinics on NordicClinic.com, or more about DNA Life and the genetic tests on DNALife.healthcare.
Thank you so much. It's been a pleasure having you here with us.
Thank you very much. I've enjoyed it very much.